It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest is going to talk about something that has been in the news and been rather controversial of late. Dr. David Reuter, pediatric physician from Allegro Pediatrics, discussing measles. And Shannon, this has gotten to be a big deal.
It's a big deal. You said it, Tom. In the media today, we hear it and see it and read it in Washington, Oregon, and California, along the West Coast particularly.
All right, here is Dr. David Reuter and Shannon O'Kelly.
Dr. David Reuters, thank you for coming down and welcome to Health Talk. How are you doing today?
I'm doing fantastic. Thank you.
Well, you're here in a good cause and a good information day because there has been a measles outbreak here in the Northwest. We've seen it a lot in the media, we've seen it a lot in the news, and there's some real concerns by parents, schools, and other people that maybe are around unvaccinated children. And it's a big issue, and I know the state legislature right now in the state of Washington is working on a bill to require vaccinations. You are a pediatrician working at Allegro Pediatrics. Tell us and our listeners about your practice.
Well, we're a general pediatric practice. We have been serving the East Side for more than 50 years. Our name used to be Pediatric Associates, and we've recently changed it to Allegro Pediatrics. There are 90 of us physicians working out of 8 offices, and we love what we do.
And your road to becoming a pediatrician is fairly unique. I read your bio, and you're educated at St. Andrews in Scotland. You went to Purdue University for an engineering degree, and then to medical school, I believe, in Pittsburgh. Is that correct?
Yep, all those things are correct. Yep.
Well, tell us about that trail. How'd you get into pediatrics?
I went into pediatrics because when I was in medical school, I just wanted to do the profession that moved me the most, and sick kids aren't supposed to be sick, and the love and compassion of their parents is incredibly moving. And so there's just nothing more rewarding for me than to be a pediatrician. And as an engineer, when there are diseases out there for which we don't have a solution, I have spent half of my career inventing solutions to the unsolved problems. And by the same token, my general pediatric practice is to care for the sick kids and inspire the healthy ones to reach their full potential. And so I feel like I found a really nice blend of both.
Well, you did a really good job setting up our topic today. You mentioned kids are not supposed to be sick. Parents are very compassionate and caring for their children, and all this ties into our topic today. Let's talk about measles, and let's kind of set it up. You know, measles have been around from mankind, probably the history of mankind, but tell us what measles is and why we should be concerned, and then we'll talk about the vaccination.
Yeah. Well, I think people used to be a lot more familiar with measles before we had vaccines and people saw the clinical ramifications of it. But the big picture is measles is a viral illness. It is spread by cough and kind of respiratory secretions. The common symptoms are an individual will develop a fever, red itchy eyes, runny nose, a cough. They have no energy. The challenge, I think, is that in the early phases of measles, it looks a little bit like a lot of other viral illnesses for maybe 3 to 5 days. And then after about 5 days, people will develop a very characteristic measles rash. For 70% of patients, it's kind of an inconvenience and you're going to get over it pretty quickly in a couple of weeks. It's the 30% of patients that develop complications. It's pneumonia, diarrhea, brain inflammation. Those are the scary things. And in children that are malnourished or where the pediatric and medical resources aren't as great, the mortality can be as high as 10%.
What you're saying is that if you get the measles, 70% of those people that contract that are going to recover, and it's just kind of an annoyance. But
Correct.
there's 30% that go on to have these sequelas, which you described as brain inflammation, pneumonia, and that's the morbidity concern then, I would imagine.
That's exactly right.
How many people statistically that get measles and that 30% that go on to develop those sequelas, as you call them, will have morbidity death rates?
In the patients with complications, it can be as high as 20 to 30%.
Okay, so that's significant. That's a significant
It's
amount, like you
huge.
said, in children. Children are not supposed to get sick like this. Now let's talk about the history of the vaccination. How long has the vaccination been around?
I think it's about 40 years.
That would make sense.
Yeah.
That makes sense.
Yeah.
So,
and in fact, if you look at the epidemiology, you see the rates of both measles infection and the complications of it being sky high back in the 40s, 50s, 60s. And if you look at the data, the rate of infection and complications has dramatically fallen as the rate of vaccination has increased. So there's no doubt that vaccination prevents both the disease as well as the complications.
More with Dr. David Reuter on measles coming up right after this timeout on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Back with more now of Dr. David Reuter and Shannon O'Kelly talking about measles.
Dr. Reuters, again, thank you so much for your time. It's a topic that is media relevant right now, and you set it up beautifully. We left off the segment talking about the vaccination, how effective it is from the data that shows. Probably came out 40 years ago. In the early years, people, had measles, but as they started to vaccinate, the measles incidence of measles dropped significantly. Tell us about the vaccination. What is it? What is it composed of?
Well, it's a two-step series. Gratefully, if a mother is vaccinated when she's pregnant, she passes her immunity on to her child, and so the child in that first year of life, for the most part, is protected. The maternal immunity starts to wane right around 12 months of age. And so we have a two-step vaccination process. We normally want to vaccinate kids between 12 and 15 months, and we vaccinate them again between 4 and 6 years.
And the vaccination usually is what they call an attenuated or a changed virus
that's
that
exactly
then
right.
you inject into the body, and the patient's immune system attacks that fake virus, if you will. It's a virus that's not going to cause measles, but it's just going to stimulate the immune system to attack that virus.
It's close enough to the virus that you cannot get the disease from it, but the body recognizes the virus enough, you develop antibodies, such that if ever you are then exposed to the virus, the body has a head start, you simply develop more antibodies, and it prevents you from both getting the disease or those kind of dangerous complications that we talked about.
And is it fair to say once you're vaccinated, those antibodies are good for life?
Yes, best to have 2 vaccinations, and then you're good for life.
So the reality is we're walking around out there in the environment and in the community, and the measles virus is out there all over us, right? And because we have this vaccination or these antibodies, we don't contract the measles, but those folks that don't vaccinate or don't have the vaccination are susceptible.
That's exactly right.
What is a concern? I know this is a big topic, but it kind of in a couple senses, maybe what is a concern for some parents? Because, they're compassionate and caring, and they don't want to vaccinate their kids because of?
I think it's 2 things. I think it's a matter of awareness, and I think it's a matter of understanding risk-benefit. And again, now that we're living in an age where most people haven't seen the measles, I think people's concern or their appreciation for just how sometimes devastating that illness is, that appreciation is decreased to some degree, number 1. Number 2, when we give the vaccine, there can be some side effects from it. Fever, for example, rash, things like that. The vast majority of these issues, they're very transient. Medically, we're not worried about them. But we absolutely understand the compassion of a parent that says, do I really want to give my child this vaccine if I don't kind of fully understand the measles disease that we're preventing? I think for us, if you look at the risk-benefit, there's absolutely no doubt that the risks of any sort of vaccination are trivial and the benefits are extraordinary. And in this outbreak that we're seeing right now, where the vast majority of kids that are sick, they're kids under age 20. Of the 66 kids in Washington, they're under age 20. And we know that we can prevent that illness if we simply do something as important as vaccinate.
Well, again, we're out of time, but it's great information. You did a wonderful job. I can just leave our listeners with, don't worry, get those kids vaccinated. That's my take on it.
Perfect.
You've been listening to Dr. David Reuter, pediatric physician from Allegro Pediatrics, talking about measles. He obviously takes a pro-immunization stance. It's very controversial right now. Parents want the right to decide whether they want to do this, whether it's for religious reasons or whatever, and it's definitely a hot-button issue.
It definitely is a hot-button issue, Tom. You remember growing up, you had measles in your neighborhood. Mm-hmm. We don't see it anymore because of vaccination, particularly.
Right.
Yeah.
Very interesting stuff. AllegroPediatrics.com if you'd like more info. Back with more after this on Como.